Tomorrow is National Doctors Day, and it's an important time to talk about the role that physicians play in our lives. Well, there are more than 14,000 audiologists here in the U.S., and this morning we are joined by one of them, Dr. Haley Owen. She's an audiologist with Livingston Hearing Aid Center. Good morning, Dr. Owen.
Thank you.
Yeah, it's great to have you with us. And again, something that is very, our senses, they're extremely important to us. That being hearing as well as one of them. Let's talk right now about, thousands of audiologists across the country. What should people look for when searching for one?
Just like in any medical profession, audiologists specialize. So it's important to find one that specializes in what your needs are. We've got pediatric audiologists, some, adult, specialize in amplification, cochlear implants, balance. There's a lot of different areas in the field. So it's important to look for one that specializes in what you're dealing with.
Absolutely. And again, the ear leads into so many different things, and like you said, it's not even just the hearing, it's the balance. It's so many different things that can be affected by issues with the ear. Let's walk us through what a typical hearing exam would look like.
Yeah, so first we're going to take you back and ask some questions about your hearing history. Any family history of hearing loss, noise exposure, if you've had a job around lots of noise, things like that. The next thing we're going to do is take a look in your ears. We want to look for any physical blockage, any problems with the anatomy, maybe infection, anything like that. Okay. Then we're going to take you to do a hearing test. It's going to be very similar to what you did in grade school. Hear the beep, raise your hand, you might press a button. Basically there we're just looking for the softest sounds that you can hear. From there we want to look at speech, how well you can understand speech. And this is probably one of the most important tests we do because with hearing aids especially, it's important to know what our possible outcome is with hearing aids. So we want to look at your ability to actually understand speech once we get amplification on you.
Wow. And again, so once that's finally diagnosed, what happens then? How does the treatment come about?
Yeah, so most hearing losses are permanent. There's no medical treatment for them. So we've got to look at what's the proper amplification for you. At Livingston, we provide free hearing testing. The sooner you can treat your hearing loss, the better. So, we recommend, starting now. The sooner you can come in, we may find you don't have a hearing loss, but we can track that over time. We can find out how quickly that hearing is changing and find out when the right time is to put amplification on you.
Yeah. And again, with your history going back with Livingston, but back till 2009. So, you've seen quite a bit. How important are those regular checkups? Somebody can't just take it for granted and say, oh, I can hear, but little do they know they might be experiencing something right now, right?
Yeah, it's funny. People really underestimate how important their hearing plays in their overall health and well-being. Just from physical health, being, balance, to our emotional, well-being, being connected to the people around us. People with untreated hearing loss are significantly more likely to experience loneliness and depression, are twice as likely to develop dementia. And are significantly more likely to fall. So, people like to put things off. Maybe hearing doesn't seem like it's such a big deal, but I think so many people just underestimate the importance of getting their hearing treated sooner rather than later.
Yeah, and again, prevention is key to stave off those the possible hearing problems that we either by nature, my experience, or just by everyday overuse or bad environment use, right?
Absolutely. It could be environmental. It's a job you have where you're around a lot of noise. It could just be getting a little bit older, and hearing loss just happens because we get a little bit older. So there's lots of different causes.
Dr. Owen, real quick, where can we find more information?
You can go to our website. That's going to be www.lhac.com. We have 3 locations here in the Albuquerque area.
All right. Thank you so much for joining us.
Absolutely.
We appreciate it.
Thank you for having me.
Yep. Now, for a full recap of this entire interview, we will have it for you at alwaysonkRTV.com.